Morning, everybody. Thanks you guys for coming. We are super excited to be kicking off our Movember Mustache Challenge, a competition between the Syracuse Crunch and the Upstate Prostate Cancer team. Here to tell you a little bit more about what's going on and the importance of Movember and prostate awareness, we're going to introduce head coach of the Syracuse University men's basketball team, Jim Boeheim.
Thank you. As a prostate cancer survivor, this is an important event for me to be a part of. I'm very pleased to be a part of this. I get to coach two teams, and whichever one wins, that'll really be the team that I coached. The other team I didn't coach. So it's a win-win for me. As everybody knows, 1 out of every 7 men will be diagnosed with prostate cancer. This is an important month coming up. I'm happy to be involved. Both these groups are I think it's a great thing. I might have wanted to grow a mustache, but I can't. So it would have taken 2 years for me to grow one. So I don't think I could be in it. But I'm proud to be part of this. It's a huge awareness month, and we have some really good people involved. And I'm going to introduce Dr. Butzowski, who is heading up his team. He's the captain of his team, and I'm going to be coaching him very hard. Sir.
Thank you, Coach. Good afternoon, everybody. If you notice, there are 6 physicians behind me, equal to a number of a hockey team. Unfortunately, there is only 1 member of the Crunch team so far, but there will be many more to join us. My goal is to share with you that the month of November, also known as Movember, is an opportunity to raise prostate cancer awareness. And men do it by doing silly things, by growing mustache or facial hair. And I have to be honest that all of us have a clean shave and a fast, clean start, and some members of the team have never wore a clean shave and always had some sort of a mustache or beard that they had to shave for today's occasion. I would like to tell you that prostate cancer care at Upstate is truly multidisciplinary, that patients are discussed at what is called a multidisciplinary setting, where the members of urologic oncology, radiation oncology, medical oncology, molecular imaging, molecular pathology are all involved in decision making before the care of the patient assumes. So without further ado, I'd like very briefly to ask each member of the team to introduce themselves. There will be a total of 20 Upstate prostate cancer team members competing with 20 Crunch team members, but 6 of these physicians represent different part of survivorship or diagnosis or care teams. Thank you.
Hi, my name is Dmitry Nikolavsky, and I have to admit that I was cheating. I was growing mustache for the last 6 months, so sorry. I needed to have a head start. I'm a reconstructive urologist, and these guys are saving lives, from prostate cancer. I'm not saving lives. I'm dealing with the quality of life, cancer survivorship, and occasionally reconstruction is needed. So that's my role.
Hi, I'm Gustavo de la Rosa. I'm a surgical pathologist and the director of surgical pathology at Upstate. We have several experienced pathologists in this area, but as well 2 dedicated ones that most of what they do is genitourinary or prostate pathology. And we have a full, very state-of-the-art molecular setting with a fully dedicated diagnostic pathologist as well, and will help with this effort.
Hi, I'm Andy Wojtowicz. I'm from the Department of Radiology. I actually had a beard and mustache that my wife was very unhappy that I shaved off today, but I promised her I'd grow it back. In our department, we have the only 3 Tesla magnet in central New York that we do multi-parametric MRI imaging of the prostate. And this imaging, coupled together with the Urinav workstation that Dr. Berganti will speak about, we're able to detect lesions in the prostate that are not visualized necessarily using just ultrasound guidance alone. And with that added tool, we've been able to identify prostate cancer lesions in patients who have previously had 2, 3, maybe 4 or more biopsies and have been deemed negative, but they continue to have evidence for disease. So this is something new that we bring to the community here.
Hi, I'm Michael Lacombe from the Department of Radiation Oncology, and it's a very exciting time in our department because the Cancer Center is just open, and it's just nice to be out of the basement for once in our life. It's a beautiful facility, but more important than the facility itself is the technology that we have. As many of you know, we opened the Vero machine, which we are we're the third machine in the country to open, and it's going to open up many avenues to try to increase the dose to the prostate but spare the normal tissue around it by the imaging and the technology of delivering the radiation therapy. So we're very excited to be utilizing this new technology in the battle against prostate cancer.
Hi, my name is Steve Graziano. I'm a medical oncologist. I've been involved in clinical trials for my entire career of 29 years. So I oversee the National Cancer Institute sponsored clinical trials, which we have at Upstate. Along with Dr. Bratslavsky, we have a full array of clinical trials that offer state-of-the-art research for our patients. So, and we just opened up in the Cancer Center as well.
My name is Sri Verganti. I'm a urologic oncologist. I was most recently at the National Cancer Institute, and as Andy Wojtowicz mentioned, we've teamed up to bring prostate imaging to the bedside, to the operating room, and to our biopsies so that we can pinpoint prostate cancer at a much earlier stage, and some cancers which hide. So we can use that to guide our robotic surgery and everything else. So it's really exciting to be a part of this. Thank you.
I would like again to thank the coach, and before we proceed with the introduction of our competition, I'd like to point out that the funds from this competition will be used for a specially designed created fund of prostate cancer care and research at Upstate Medical University. And now it's my honor and pleasure to introduce Joey Marmino, who is a defenseman for a Crunch, who is going to be taking a team of 20 Crunch players to take on the 20 Upstate Cancer Institute players. Joey.
Well, it's an honor to represent the players here today. Sorry they couldn't make it, but looks like we have our hands full. A little bit of an age difference, but a lot of the guys have a head start, but we'll try and convince them to shave it. Prostate cancer is something that's touched my family personally. My father-in-law is a survivor. It's a few years now. He's doing great, and so something I've dealt with personally, and it's a great cause. I know the players on the team are excited to be a part of it, and like you said, anytime we grow a silly mustache, happy to do it. So.
It's been 12 years now, so every year I get a few phone calls from people and just to ask about the experience and what happens. And I think research and treatment is much better today. I think the awareness factor is the key, getting people to get tested and to find out early. The best way to beat cancer is early detection, and hopefully, people are aware of that. This project will help make people aware of that. I think that's really the key.